As you can see, a lot of mothers are impacted by this. For those of you who are just tuning in, thank you so much for joining us on Live Impact News on WCNC Plus. I'm Siobhan Riley. The time right now is 7:03. We are talking about mothers who are impacted when it comes to infant mortality rates. Right now, we are joined by Dr. Shameka Fairbanks. She is the Health Equity Director for Alliance Health. Thank you so much for being with us today. Can't hear you. Can you hear her, Rusty? Can you hear us? I cannot hear her. Can you hear us now?
Yes.
Check 1, 2. Okay, I can hear you now. Thank you so much for being with us today. Sorry, we're having a little bit of technical issues. It's so great to be with you. You just heard that story, and we've been talking about mothers who are impacted when it comes to infant mortality. We know that April 11th through the 17th is Black Maternal Health Week. Can you talk a little bit about why are so many women of color impacted when it comes to infant mortality?
Absolutely. Thank you so much. So if you'll allow me to just share a little bit about the disparity gap and really kind of how we got started. This really dates back to 400 years ago. So it's not anything new. It's so unfortunate. But when you think about the overall history of Black women and how we were impacted, it goes back to the 1600s through the enslavement era of the mid 1860s. And so there was a time when Black women were subjected to tumultuous conditions. They were medically experimented on. There were experimental surgeries where enslaved women were receiving surgeries without consent as well as without anesthesia. And there was a talk about them basically feeling less pain. And obviously that's something that's not true. And so the medical mistrust, mistreatment has just really continued over centuries. And still today, as you said in the very beginning, we are 3 to 4 times more likely to experience some type of maternal mortality, which is higher than the U.S. average.
Yeah, that's very high. Can you talk a little bit about what steps is your department taking to combat this issue?
Absolutely. So while Alliance Health doesn't specifically have maternal health specific interventions, we do understand that it really is taking much more of a holistic approach. So when you really think about, doulas as well as midwives and other elements that really help in the Black community to not only be able to build trust, but really be able to be that liaison in the community, it's just so important. So when we look at a few things, we can really speak specifically on providers. So it's important that providers have culturally competent awareness that every single patient is different. It's also important for patients to really understand how they're feeling, really being able to name it. Maybe not specifically certain conditions, but being able to express how they're feeling, and also really being intentional with ensuring that they're getting the care that they need, because they are the mouthpiece for themselves and their babies. And then when you think about the providers aspect, it's so important as well that they're treating their patients with just respect and dignity. And then next, really just taking that community-based intervention. So, doulas, for example, provide non-clinical support that are emotionally and socially important as well to the moms and the babies. They provide care through labor, through delivery, as well as postpartum care. And research actually shows that they assist in reducing numbers of C-sections. And so I think that it's really necessary to take that huge view, a holistic view, in order to be able to see the disparities impacted and change the numbers.
And Dr. Fairbanks, you brought up a really good point. You spoke about just the importance of these mothers being treated with respect and dignity. And we heard from 2 of those mothers recently. And one of the mothers I spoke with, she said she didn't feel like she was getting support from her doctors. She kept telling her doctors that something wasn't right, that she was feeling pain. What are some of the people who you speak with, some of those mothers, what are some of their biggest concerns when you talk with them?
It's really unfortunate. Having a baby really should be a joyous time, a time of peace, harmony. And unfortunately for Black mamas, it really can be a time of fear. So I think it's just really important for moms to be equipped and just ensuring that they have that information to be able to, hear make sure that their stories are heard. I also think it's really vital. The CDC, for example, also has like a Hear Her campaign. And so you have people in the community like, Serena Williams, as well as Allison Felix, who have stepped up and are really sharing their platform and their story. And so I think that that also is really impacting just the level of maternal mortality and just overall health, which is obviously so very important. It's a huge gap, not just regionally, not just in our state, but globally as well.
And what is your message to the doctors? I know that, you have good doctors and you have not so good doctors. What would you say to those doctors? Because I hear from so many women, especially women of color, who say they are really afraid sometimes. There's so much fear when it comes to going to the doctor. So what would you want to say to them?
I would say they are the mouthpiece for themselves. They are the mouthpiece for their unborn children, and they are standing on the shoulders of giants. And so I think it's so important that they, make sure that they are heard, that they are just relentless and intentional with ensuring, hey, something is wrong, something's not right, naming their symptoms, sharing that information, and making sure that they don't leave until they get the care that they deserve.
Care that they deserve is so important. And lastly, I just want to ask you these resources. I know that there is a Care Ring. It is a maternal health conference that's coming up, hosted by Care Ring. It's the third annual conference. It's also presented by Novant Health, and that's April 9th from 8:30 to 4 o'clock at Friendship Missionary Baptist Church. Can you close by just talking about the importance of having these resources available for these mothers?
Absolutely. It is so, so very important. When you just think about crisis management, when you think about critical conditions, it's so important to be able to have education, to be able to have advocacy campaigns in place, to be able to have those resources for mom, for babies, for families. And so I think that that's great. As you said, it is also April. April is also National Minority Health Month. And so that's also something that we want to keep in mind. And so those resources are absolutely vital in order to be able to be intentional with the holistic care that we deserve.
Very good information. We really appreciate you joining us. Before I let you go, is there anything else you want to say or add?
No, I really appreciate the time. I think that we definitely have a way to go, but I think having these conversations and discussions are very vital in order to be able to get us to a better place with decreasing the numbers.
Such an important conversation. Dr. Fairbanks, thank you so much for being with us today. We really appreciate your time on this Saturday.
It's my pleasure. Thank you.
Thank you, and I hope you have a good day. And just to remind you again, Caring is hosting its third annual maternal health conference that is presented by Novant Health, and it's April 9th from 8:30 to 4 o'clock. That is going to be held at Friendship Baptist Church. And again, just to recap, we were talking about a newly released report, and it shows that 70 babies die every year in Mecklenburg County. And when it comes to Black babies, they are 3 times more likely to die. So you just heard about some of the resources that are available. And we're going to continue to have this conversation throughout the month. As we told you, Black Maternal Health Week is April 11th through the 17th. We're going to go ahead and go to break. Coming up next, we're going to hear about a youth violence prevention conference that is taking place in Monroe. We're going to have much more on that, so be sure to stay with us.